So guess what? Dr. Fauci, again, is being exposed, this time in Newsweek magazine, how Fauci fooled America. This is an opinion piece printed in Newsweek, but who were the people who wrote it? Martin Kulldorff, he's a PhD, an epidemiologist, biostatistician, and professor of medicine at Harvard Medical School. That's a lot. Jay Bhattacharya, MD, PhD, is a professor of health policy at Stanford University School of Medicine. Okay, ready? So here's what they're really laying it down. Well, we've broke it down for you many times here that Fauci is a pathological liar captured by Big Pharma, and he won't even tell you that we should have Medicare for all because that would have reduced the deaths from COVID by 200,000 people. He never mentions it. Why do you think that is? The head of... Anyway, here we go. When the pandemic hit, America needed someone to turn to for advice. The media and public naturally looked for Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, an esteemed laboratory immunologist, and one of President Donald Trump's chosen COVID advisor. I always forget that Donnie Tiny-Hands Fauci was Donnie Tiny-Handed picked by Donald Trump to be on the COVID advisory committee. I always forget that Trump picked him to be on the advisory committee. Anyway, here's what they say. Unfortunately, Dr. Fauci got major epidemiology and public health questions wrong. Reality and scientific studies have now caught up with him. Natural immunity. Here you go. By pushing vaccine mandates, Dr. Fauci ignores naturally acquired immunity among the COVID recovered, of which there are more than 45 million in the United States. In fact, we just looked it up. It's up to 47 million people who've had COVID. And mounting evidence indicates that natural immunity is stronger and longer lasting than vaccine-induced immunity. In a study from Israel, the vaccinated were 27 times more likely to get symptomatic COVID than the unvaccinated who had recovered from a prior infection. That's quite a stat, don't you think? That should enter into whether they should be mandated to get a vaccine or not? I think so. Dr. Fauci doesn't have a strong answer for us on that. Under Fauci's mandates, hospitals are firing heroic nurses who recovered from COVID they contracted while caring for COVID patients. So these people are the heroes who would go into those hospitals in the ICUs and work on people with COVID, contracted the COVID, risked death themselves, got better, and now they're going to fire them. So those people aren't cowards, because they're willing to go work with people who had COVID when there was no vaccine. Those are the exact kind of people they should be hiring. People with natural immunity and that kind of courage. But instead, we're throwing them into the dustbin of our culture. With their superior immunity, they can safely care for the oldest and frailest patients with even lower transmission risk than the vaccinated. After more than 700,000 reported COVID deaths in America, we now know that lockdowns failed to protect high-risk older people. When confronted with the idea of focused protection of the vulnerable, Dr. Fauci admitted he had no idea how to accomplish it, arguing that it would be impossible. That may be understandable for a lab scientist, but public health scientists have presented many concrete suggestions that would have helped. And had Fauci and other officials not ignored them. What can we do now to minimize COVID mortality? Well, current vaccination efforts should focus on reaching people over 60 who are neither COVID recovered nor vaccinated, including hard-to-reach, less affluent people in rural areas and inner cities. Instead, Dr. Fauci has pushed vaccine mandates for children, students, and working-age adults who are already immune, all low-risk populations, causing tremendous disruption to labor markets and hampering the operation of many hospitals. School closures, that's another one. So schools are major transmission points for influenza, but not for COVID. While children do get infected, their risk for COVID death is minuscule. We've reported this before. Lower than their already low risk of dying from the flu. So a child has such a low risk of serious illness or hospitalization from COVID. It's so low, it can't be measured. In fact, it's so low, it's less than the flu. And Fauci wants to inoculate every one of them. And then people would say, yeah, well, you got to inoculate the kids so they don't spread it to their grandparents and kill their grandparents. Hey, why aren't their grandparents vaccinated? Get your grandparents vaccinated because vaccines only protect yourself. We've already found out that people who get COVID and are vaccinated can shed the virus and are just as likely to spread the virus as someone unvaccinated in their house. That's a Harvard study. So that's why that's not a good argument of why you should vaccinate children so they don't spread it to their grandparents, because everybody spreads it when they get COVID, even the vaccinated. So that doesn't make sense. Why would you push vaccines on children when they have almost uncalculable risk of it? It's incalculable, so low. Why would you do that? And it doesn't matter about spreading it because everybody spreads it when they get it. Why would you do that? I don't know. I don't know, Big Pharma. Throughout the 2020 spring wave, Sweden kept daycare and schools open for all of its 1.8 million children ages 1 to 15 with no masks, testing, or social distancing. The result, 0 COVID deaths among children and COVID, and a COVID risk to teachers lower than the average of other professions. Now, Sweden did have like 9 kids who died of COVID, but they didn't catch it in school. That's not where that came from. So the result, 0 COVID deaths among children. So, and by the way, you can't really go by Sweden, right? Because they do a lot of crazy shit, like they have national health care for all their citizens, you know. They have national health care for everybody. In the fall of 2020, most European countries followed suit with similar results. Considering the devastating effects of school closures on children, Dr. Fauci's advisory for school closures...
Advocacy.
All right, let's start that over. In fall 2020, most European countries followed suit with similar results. Considering the devastating effects of school closures on children, Dr. Fauci's advocacy for school closures may be the single biggest mistake of his career. Well, is that really the biggest mistake? I would have thought it was funding an all-you-can-eat bat soup buffet at the Wuhan labs. Maybe that was his biggest mistake. Well, that and also approving puppies having their faces eaten alive by insects. That could have also been. But it's up there. It's definitely up there. How about masks? Now, we've shown you how he lied about masks, then said he was lying about masks. Now you can trust him about masks. And then he lied about herd immunity. Then he said, now you can trust him about herd immunity. Then he lied about funding gain of function. And he lied to Congress, and he never corrected that lie. And he should be in jail. Masks. The gold standard of medical research is randomized trials. And there have now been 2 on COVID masks for adults. For children, there is no solid scientific evidence that masks work. A Danish study found no statistically significant difference between masking and not masking when it came to coronavirus infection. Well, Sure, it makes no statistical difference, but it does make shitlibs feel safer. And isn't that what science is really all about? In a study in Bangladesh, the 95% confidence interval showed that masks reduce transmission between 0 and 18%. Hence, masks are either of zero or limited benefit. There are many more critical pandemic measures that Dr. Fauci could have emphasized, such as better ventilation in schools or hiring nursing home staff with natural immunity. I mean, I'm sure a lot of people say, well, I'll take the 18%. I'll take it. I'll take the, right? Isn't that what a lot of people are going to say? I think that's what a lot of people are going to say. How about contact tracing? For some infectious diseases, such as Ebola and syphilis, contact tracing is critically important. But for commonly circulating viral infections, such as COVID, it was a hopeless waste of valuable public resources that did not stop the disease. This is correct. Collateral public health damage. Now, I brought this up at the beginning of this. Collateral public health damage, a fundamental public health principle, is that health is multidimensional. The control of a single infectious disease is not synonymous with health. As an immunologist, Dr. Fauci failed to properly consider and weigh the disastrous effects of lockdowns would have on cancer detection and treatment. I know my favorite dental hygienist found out she had cancer, but she didn't find out till it was almost too late when it was already stage 3 because she couldn't go in to get her it looked at because of coronavirus. So that speaks, I have a personal experience with this. Wow, he failed to properly consider and weigh the disastrous effects lockdowns would have on cancer detection and treatment, cardiovascular disease outcomes, diabetes care, childhood vaccination rates, mental health, opioid overdoses, to name a few. Americans will live with and die from this collateral damage for many years to come. How about the alcoholism rate? I bet it went sky. My doctor told me, she said, everybody who I see is drinking more. We drink more. We started drinking. We started having 2 cocktails every night. We never did that before. In private conversations, most of our scientific colleagues agree with us on these points. While a few have spoken up, why are not more doing so? Well, some tried but failed. Others kept silent when they saw colleagues slandered and smeared in the media or censored by big tech. There you go. Some are government employees who are barred from contradicting official policy. Did you know that? Did you know that some government employees are actually barred from contradicting official policy? No. Some employees, and also all establishment news outlets. Many are afraid of losing positions or research grants. Aware that Dr. Fauci sits on top of the largest pile of infectious disease research money in the world. Most scientists are not experts on infectious disease outbreaks. Were we, say, oncologists, physicists, or botanists, we would probably also have trusted Dr. Fauci. The evidence is in. Governors, journalists, scientists, university presidents, hospital administrators, and business leaders can continue to follow Dr. Anthony Fauci or open their eyes. After 700,000 plus COVID deaths and the devastating effects of lockdowns, it is time to return to basic principles of public health. Wow. You know, but I ordered a bunch of those pillows with Fauci's face on them now. What am I supposed to do now? I just threw out all my Andrew Cuomo pillows. What am I supposed to do? Jesus Christ. So if you want to know who Fauci is, let's just watch him lie about this.
People should not be walking around with masks. Let me just state for the record that masks are not theater. Wearing a mask might make people feel a little bit better, and masks are protective. But it's not providing the perfect protection that people think that it is.
Mark, there has not been any indication that putting a mask on and wearing a mask for a considerable period of time has any deleterious effects.
By the way,
There are
I think Mark Zuckerberg should be mandated to wear a mask at all times. I think isn't it amazing how lifelike Mark Zuckerberg's human mask looks? You can still tell it's latex, but it looks good overall, I would say. Doesn't it? It looks really good. That looks good. Okay.
Any deleterious effects.
there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
And can you get some schmutz sort of staying inside there?
Of course.
You do not need to wear a mask indoors if, in fact, you've been vaccinated. Good that you're vaccinated, but in a situation where you have people indoors, particularly crowded, you should wear a mask.
So even if you are vaccinated, you should wear a mask. If in fact you are vaccinated, fully vaccinated, you are protected, and you do not need to wear a mask outdoors or indoors. When the children go out into the community, you want them to continue to wear masks.
You know, if you look at children outside, particularly when they're with the family, walking down the street, playing a game or what have you, don't have to wear a mask.
The Academy of Pediatric actually makes that recommendation that children should be wearing masks from 2 years old onward.
And you're asking now, if your child is a member of your household, can you walk outdoors with your child without a mask? According to that chart, the answer is yes.
But the child can't, not to beat it to death.
Yeah. Yes.
Okay. Because now the CDC says, I mean, I think I've got this right. 1 mask is better than 0 masks. 2 masks is better than 1 mask. But you don't have to have double masks. Is that right? I mean,
it became clear that cloth coverings that you didn't have to buy in a store, that you could make yourself, were adequate. And then you want it to fit better. So one of the ways you could do it, if you would like to, is put a cloth mask over, which actually here and here and here, where you could get leakage in, is much better contained.
and are you a double masker, Dr. Fauci? It looked like you are.
So that's the kind of guy Dr. Fauci is. And let's remember, here's Kerry Mullis, inventor of the PCR test and Nobel laureate in chemistry. This is what he says about Fauci.
And listen, you know, these guys like Fauci get up there and start talking, you know, he doesn't know anything really about anything. And I'd say that to his face. Nothing. The man thinks you can take a blood sample and stick it in an electron microscope, and if it's got a virus in there, you'll know it. He doesn't understand electron microscopy, and he doesn't understand medicine, and he should not be in a position like he's in. Most of those guys up there on the top are just total administrative people, and they don't know anything about what's going on at the bottom. You know, those guys have got an agenda, which is not what we would like them to have, being that we pay for them to take care of our health in some way. They've got a personal kind of agenda. They make up their own rules as they go. They change them when they want to, and they smugly, like Tony Fauci, does not mind going on television in front of the people that pay his salary and lie directly into the camera.
And we just showed you how he loves to do that. And but Anthony Fauci said if you criticize him, you're criticizing science. So isn't it sad to find out that a Nobel laureate chemist doesn't believe in science? Isn't that something? How did he even win the Nobel Prize when he hates science so much? I mean, come on. And so here and so they're catching on, right? So in Vanity Fair, it says a major shift. NIH admits funding risky virus research in Wuhan. So I said, we've been reporting for over a year now, Fauci is a pathological liar and definitely not to be trusted on anything. Good to see the establishment hacks catching up. So now you know the rest of the so people are catching up. That was printed in Newsweek. So I think people are catching on to Fauci. People are catching on to that everyone's going to eventually get COVID, and stop making your neighbor your enemy. Okay, your neighbor's not your enemy. The unvaccinated are not your enemy, because even if you're vaccinated, you're going to spread it to someone else. And even if you're vaccinated, you're going to get it. So who do you care if you get it from? So get prepared to get it. If you're vaccinated, it will lessen your severity of your illness and your chance of hospitalization. It doesn't end it. People all the time die who are vaccinated. Look at Colin Powell, just for a recent example. But There you go. That's the science, and that's the science on Fauci. I want to let you know, on November 6th, we're going to be in Baltimore. November 11th, we're in Tempe, Arizona. November 12th, we're doing Los Angeles and Studio City. November 19th, Los Angeles and Studio City. And then Thanksgiving weekend in Portland, Oregon. Go to jimmydorecomedy.com for a link for all those tickets.